Well, we've had a lot of reaction to our story from last night about a young boy who suffers from a rare disease in need of a $500,000 treatment the government refuses to pay.
Tonight, a similar story, but in this one, their boy is receiving treatment, and the difference in his health has been remarkable. Christina Stevens has part 2 in her special report.
I need my medicine.
It's a routine 3-year-old Isaac McFadyen knows well. Every week for exactly 1 year now, he's been receiving life-saving enzyme replacement therapy at Sick Kids Hospital.
Oh, hold still, sweetie.
As tough as it looks, Isaac's mother is thrilled to be here. This is no ordinary treatment. Isaac suffers from a rare disease known as Moritolami syndrome, which causes carbohydrates to build up in his tissues. The medicine costs about $400,000 a year. And as Isaac grows, so will the cost, up to $1 million.
If we weren't getting ERT, of course, it would have continued to progress and get worse.
But initially, the Ontario government refused to pay for it, forcing the McFadyens into a months-long battle to get the decision overturned.
We still are, grateful every day. Like, it really hasn't, in a way, it hasn't worn off that relief and that, feeling of being overjoyed about it.
All right. Wow. One down. You're amazing.
But the Canadian Organization for Rare Diseases points out other families haven't been so lucky.
There are no policies for dealing with rare disorders, and it's a very, very sad way to run a drug program in this country.
They want the government to put a small percentage of total health care dollars into a special fund for rare diseases, saying it's clear they need to be dealt with differently and pointing out there are several countries which are much further ahead on this issue.
France has a very unique system that basically says once a drug is approved, it's up to the government. They have to find a way of funding this drug.
But it seems Canada is in no hurry to catch up.
Provinces, territories, and federal government have been talking about developing a strategy for at least 3 years now.
Meanwhile, Isaac's mom says her heart is with families fighting for their kids.
They should never give up. I mean, even when your goal seems beyond reach.
And here she says is the proof. Isaac started growing again, his organs are returning to normal, and other than coming here, he's much like any other 3-year-old.
Okay. Bye. Ciao, everybody.
Well, supporters of a separate fund for rare diseases say even though the drugs for some of those disorders are extremely expensive, the overall cost would be relatively low. That's because there are so few people affected. And they say this piecemeal approach where every province treats these cases differently and often with very little transparency simply has to change.
Quite a brave little boy. Thanks, Christina.
Still